Linda turns 65 next month. She just opened a thick envelope from Medicare, 4 letters staring back at her, A, B, C, and D, and a deadline she didn't know existed. Get those letters wrong, and she could overpay by thousands of dollars a year for the rest of her life. And almost nobody explains them in a way that actually makes sense. So today, we fix that. In plain English, what Medicare Parts A, B, C, and D really are, what each one actually costs in 2026, the 2 different ways you can put them together, and the one thing you must do before your window closes. We're going deep, because this isn't trivia, this is the money you'll live on. And one promise up front, we don't sell insurance, we never will, so there's no pitch here, just the truth and where to get free help. Here's the whole thing in one picture before we start. Medicare isn't one plan, it's 4 building blocks. Part A and Part B are the foundation the government gives you. Part C is a private company's way of repackaging that foundation. And Part D handles your prescriptions. Once you see how the blocks fit, the envelope stops being scary. So let's take them one at a time. Part A is the hospital part. A is for admitted. It covers your inpatient hospital stay, a skilled nursing facility after a hospital visit, hospice care, and some home health. And here's the good news. If you or your spouse paid Medicare taxes for about 10 years, Part A costs you nothing in monthly premiums. 0. You already paid for it, quietly, your whole working life. But free doesn't mean no cost when you use it, and this is where people get surprised. Each time you're admitted, you owe a deductible. In 2026, $1,736. That covers your first 60 days. Stay longer, and from day 61, it's $434 a day. For a skilled nursing facility, the first 20 days are fully covered, but days 21 through 100 cost you $217 a day. And here's the part that trips everyone up. That deductible is per benefit period, not per year. If you're hospitalized in spring, recover, then go back in the fall, you can pay it twice. Part A is generous, but it is not unlimited. Part B is the doctor part. B is for becoming a patient anywhere outside the hospital. Doctor visits, lab work, outpatient procedures, x-rays and scans, your yearly wellness visit, even the walker or wheelchair if you ever need one. Most preventive care, your annual checkup, many screenings, is completely free under Part B. Unlike Part A, Part B has a monthly premium. For most people in 2026, that's $202.90 a month, usually taken straight from your Social Security check. Higher earners pay more. Then a small yearly deductible of $283, and after that, you pay 20% of the bill. Now hold on, because this is the single most important sentence in this whole video. Original Medicare, that's Part A and Part B together, has no cap on that 20%. None. There is no number where Medicare says, you've paid enough this year, we'll cover the rest. 20% of a routine visit is pocket change, but 20% of cancer treatment, or heart surgery, or a long hospital stay can be tens of thousands of dollars with no ceiling. That open-ended gap is the whole reason the next 2 letters exist. So let's talk about how you close it. Part C is Medicare Advantage. Instead of getting A and B straight from the government, you let a private insurance company run your Medicare for you. They bundle Part A, Part B, almost always your drug coverage too, and they usually add things original Medicare never covers. Dental, vision, hearing, sometimes a little money back. C is for combined. Now, you still pay your Part B premium. Advantage doesn't replace it. But here's the trade that matters most. Remember that missing cap? Advantage plans are required to have one. In 2026, the most you'd pay out of pocket for your covered medical care is capped. By law, it can't exceed $9,250 in network, and the average plan sets it lower, around $5,400. That ceiling is the real appeal. The cost of that ceiling is freedom. You're now inside the company's network of doctors. You may need referrals, and the plan can require prior approval before it pays for things. So it isn't good versus bad, it's a cap and network plan versus open choice but no cap. We put the two systems head-to-head in the next episode because that one decision deserves its own video. Part D is the prescription part. D is for drugs. If you take any regular medication, this is the letter that protects you. You get Part D one of two ways: as a standalone drug plan added on to original Medicare, or baked into a Medicare Advantage plan. Premiums vary by plan, and a plan's drug deductible can be up to $615 in 2026. But here's the headline, and it is genuinely great news. The old donut hole, that frightening gap where your drug costs used to suddenly explode in the middle of the year, is gone. In its place is a hard cap. No matter how expensive your prescriptions get, you will not pay more than $2,100 out of pocket for covered drugs this year. And if even that is tight on a fixed income, there's now a payment plan that lets you spread it across the months instead of all at once. For someone on a serious, expensive medication, that single change is life-altering. Now one more piece, because you'll hear the word and wonder. There's something called Medigap, or a Medicare supplement. It is not a part. It's the other way to close that 20% gap. Instead of switching to Advantage, you keep original Medicare and buy a private supplement policy that pays those deductibles and coinsurance for you. The one rule to remember today: you can have a Medigap policy or a Medicare Advantage plan, never both. That fork is exactly what the next episode is about. So let's go back to Linda. She almost did what so many people do. She signed up for Part A because it's free and decided to skip Part B to save the $200 a month. Then in March, she needed knee surgery. With Part B, she'd have paid her deductible and her 20% and moved on. Without it, she was facing the entire bill herself, plus a Part B late penalty that adds 10% to her premium for every year she delayed and never goes away. Her little savings would have cost her many times over. Now, to be fair, sometimes delaying Part B is exactly right. If you're still working at 65 with solid coverage from your employer, you can often wait with no penalty at all. The honest truth is that the right answer depends on your situation, and anyone who hands you a single one-size-fits-all rule is probably selling something. So lock the whole picture in one breath. Part A is the hospital. Part B is the doctor. Together, they're original Medicare, complete coverage but with no spending cap, which is why you add protection. Part C, Advantage, is the private all-in-one that adds a cap and extras in exchange for a network. Part D covers your prescriptions, now with a $2,100 ceiling. And Medigap is the optional patch that caps original Medicare instead. 4 blocks, 2 ways to build. That's Medicare. And here is the one thing to do, today, not later. Find your initial enrollment period. It's a 7-month window. The 3 months before the month you turn 65, your birthday month, and the 3 months after. Write it on your calendar right now. Inside that window, you choose your letters with no penalty. Miss it, and those penalties, on Part B and Part D both, can follow you for the rest of your life. One window, one decision. Don't let it pass quietly. If you'd like a real person to walk through your own situation, for free, with no sales pitch and no commission, call your state health insurance assistance program. They're called SHIP counselors, and you can reach them through 1-800-MEDICARE. They work for you, not for an insurance company. One quick question before you go, and drop it in the comments. Are you leaning toward original Medicare or toward Medicare Advantage? I read every reply, and your answer shapes what we cover next. Speaking of, the very next video tackles exactly that fork. Medicare Advantage versus a Medigap supplement, the choice that touches every other letter and is the hardest to undo. It's waiting in the Start Here playlist linked below, along with the deeper dives on enrollment and costs. Subscribe so the rest of your Medicare lands in your feed, in plain English, every week. This is general information, not advice, and we're not affiliated with Medicare, so always check your own situation. I'm really glad you're here. I'll see you in the next one.